Hello and welcome. You found the Social Work Podcast. My name's Jonathan Singer, and I'll be your host as we explore all things social work. Today's podcast is the second in a two-part series on clinical hypnosis. Today I talk with Dr. Elizabeth Winter about how and when to use clinical hypnosis. In part one, I spoke with Dr. Winter about the history of clinical hypnosis, key assumptions, goals, the client's role, and the types of problems that might be addressed with clinical hypnosis. To listen to the first podcast or to get more information about hypnosis and specifically clinical hypnosis, please visit the Social Work Podcast website at socialworkpodcast.com. And now, on to the interview with Dr. Winter and clinical hypnosis. So as a clinician, how do you decide when to use hypnosis?
Probably the first caution is to use it only to do something that you're already trained to do. And that may sound a little bit obvious, but for example, it would be appropriate for me as a social worker to use it for somebody who comes to see me for work on addictions. It would not be appropriate as a social worker for me to help someone to induce analgesia or anesthesia with an intention of my performing surgery on them. I'm not trained to do that. I shouldn't do it. And conversely, somebody who is perhaps an anesthesiologist shouldn't be doing psychotherapy using hypnosis. So it may seem obvious, but it's really important so that you don't work outside your field or do anything that you're not already trained to do. Having said that, not everyone's going to want hypnosis, and it's not going to be something that I would do with everyone. If somebody specifically comes and asks for a hypnotic intervention, typically I would do that as part of a broader therapeutic relationship, and it may or may not be appropriate. For example, people will sometimes specifically ask if they can use hypnosis to recover memories, typically memories that they think they may have buried somewhere about past abuse. Now, I won't do that kind of work, and I won't do it for a number of reasons. The primary one being memory is not history, and the fact that you recall something in a trance state doesn't make it true. And in fact, there is a fair amount of research that suggests that people who appear to remember things in trance have a higher degree of confidence in those memories, but less accuracy. So that would be a time not to use it. If someone is motivated to use it for something like habit control or anxiety, then certainly it's worth exploring, and you would start out by teaching the skill before you would use it for the specific purpose. And I'll give you a quick example of that. I once heard a story of a woman who had grown up in Europe and was towards probably her middle years looking to stop smoking. She'd smoked for many, many years, and she wanted to use hypnosis to stop smoking. And what she found was that she really got stuck going into trance and kind of couldn't go into trance. And when she was asked what her first memory of smoking was, when did she start smoking? It was when she had been smuggled out of Germany in the late 1930s, early 1940s, during the Second World War. She'd been smuggled out. She was a Jewish woman. And when she crossed the border into Switzerland, someone gave her a cigarette. And as she took the first puff of that cigarette, they said, "This is what freedom tastes like." And so until she knew that she had, her belief in freedom paired with her smoking habit, then no amount of teaching her to go into trance was going to make any difference. And sometimes you find those things out as you work. So it really depends. It depends on, do you have the training and the skill set to do a particular piece of work? And if you wouldn't do it without hypnosis, you shouldn't do it with.
So you use clinical hypnosis when someone asks for it, when it seems clinically appropriate, but also with the caveat that hypnosis is used within a treatment context that is within your scope of expertise and your scope of practice.
Exactly.
Let's say that all these criteria have been met with a client. You've decided to use it. How do you actually use clinical hypnosis?
The first thing I do is to help someone learn how they best go into trance. There are a number of different inductions. So, probably the one that people are going to be most familiar with is fixing their eyes on a particular object, which need not be a watch and it need not be swinging in front of one's face. I will say that quite categorically now. But there is something called an eye fixation technique, and this is one of what is known as the formal inductions. And when I talk about using hypnosis and what is ethical and what's appropriate, I'm really talking about this sort of formal induction of hypnosis. Now, the eye fixation may be helpful for somebody who is more visually oriented, and there are other forms of formal induction. One, for example, is an arm levitation induction. So that would be perhaps, to someone who is more comfortable with something more physical or more body-oriented rather than visual. There's another one which focuses more on the ability to visualize things. So that may be more appropriate for someone who thinks in that way. So there are different formal inductions. To use those help somebody to learn how to go into trance. Once somebody is in trance, then a clinician would add what we would think of as a utilization, which would be, what is it we're trying to accomplish? It may be suggestion in a fairly direct way. So, one might say to somebody, you'll be surprised at how much more comfortable you will be when, as you monitor your breathing and slow down your next breath out, you will find that you become calmer, more relaxed, and so on. Simple example of just relaxation based, but that's the utilization part of the trance. There may then, within that or following that perhaps, be a suggestion for how that comfort or whatever it is will follow that person once the trance has ended. So just because the trance ends, they don't have to stop feeling comfortable. So that comfort can go with you. That's the post-hypnotic suggestion part of that. And then there is a termination of the trance experience. So, which may sound something like, you return your attention to the room in your usual way, in the next few breaths, and so on. So there is usually a structure to the formal induction of trance. So, but the induction, the induction of a trance state is really just the beginning of that, and that will be completely, really individualized for the person. There are some standard forms of script. Actually, some really, really nice publications that have standardized scripts, and people often make their own, but there are some really nice pieces of work for different applications. Now, formal induction is not the only way to use an understanding of hypnosis in a clinical setting. Now, here's the deal. Since we go into trance spontaneously, I can intentionally, as I've said, work with someone to induce trance sitting in my office, but I can't stop them spontaneously going into trance in my office. What I can do is recognize it and work with it, because some spontaneous trances are useful and some are really quite harmful. So if there is a trance state which is what we would think of as a negative trance, so a highly focused attention, perhaps in a relational situation that is really, really negative, then my recognizing when someone has gone into that sort of highly focused state, but it's not working well for them, is something that can be very useful clinically.
So would this be something that you might recognize in a couples therapy session?
Oh, sure. An induction into a trance state doesn't have to be intentional, obviously. So couples have a well-worn path into an argument, into an old disagreement, into the you always do this, you never do that. So that can certainly operate as an induction, if you like, where the focused attention, or perhaps even more often focused disattention. Let's say the induction is, you never, and then the other party disappears. They're not listening after that. They have defocused. They have gone elsewhere. Could you view that as a couple's trance? Certainly. I think it's also helpful to consider negative trances that children go into, and what operates as an induction, perhaps for a child in a negative way, might be the, you're stupid, you never listen, you never get this right, you're always so clumsy. And at that point, children often defocus and go elsewhere. And they're in their trance where they can't get anything right. And so, of course, they don't. I think that can be a very helpful frame for parents to understand, for teachers to understand. Now, on the positive trance side for children, I think it's helpful again for parents, teachers, families to understand when a child is not being inattentive or disobedient, but simply highly focused in their internal world. So just useful ways to use that conceptualization of trance in a way that is helpful but does not involve necessarily a formal induction of a trance state, but really the recognition of naturally occurring states.
So it sounds like there's a distinction between these naturally occurring and these formally induced trance states. And you've talked about positive and negative trance states. Are there limitations or strengths to clinical hypnosis in terms of the formal work that a clinician would do, not the naturally occurring trance states? But are there strengths and limitations? Are there contraindications in terms of the clinical usage of hypnosis?
I think there are times when you absolutely wouldn't use it, and we've certainly mentioned, where you're really not trained to. You may understand trance work, but you may not be appropriate for you to use it in a particular area. Contraindications for me as a social worker, seeing people for psychotherapy, I typically probably would not use hypnosis for someone who has psychotic symptoms, because they're experiencing altered states in any case, and adding in another form of altered state really is probably not going to be helpful. It just isn't.
That makes sense.
So I wouldn't do it. I think I've already mentioned that I don't do memory retrieval work, and again, that is something to be really cautious of. Might somebody remember something during the course of psychotherapy? Absolutely. Memory is not a continuous thing. Might somebody remember something while they're in trance? Certainly, but I wouldn't go fishing for it. I wouldn't use trance if somebody said, I only want to do this and nothing else. That's like telling a surgeon all they can use is the scalpel. Nothing else, no retractors, no forceps. You wouldn't limit yourself in that way. One aspect of using clinical hypnosis that I think is important for people to bear in mind is that where there is a legal case going on, the admissibility of your client's evidence can really be put in jeopardy by that person having done hypnosis. Not because hypnosis makes them a less credible, well, literally makes them a less credible witness, but the law certainly views it that way. If you're a forensic, if you're doing forensic work as a therapist or as a psychiatrist, you probably would not want to be using hypnosis. And it's appropriate, if somebody wants you to work with hypnosis, or if you're considering it, to bear in mind that if they have a case pending, or they might have a case against an abuser, for example, that their testimony could be set aside in court. if you're thinking of using clinical hypnosis with someone, to really discuss with them in a psychotherapeutic setting whether this is something they're comfortable with. Not everyone is going to be comfortable with it. And there's some real cultural differences on the use of hypnosis, with some people being very comfortable and some people being extremely uncomfortable and not feeling okay with that at all.
And you're talking about informed consent, essentially.
Absolutely.
Yes.
Yes. And obviously, that applies to anything, but certainly to this. Partly because of the misconceptions around it. Just because I think it's a great idea, if my client doesn't, then we're not doing it. It's really simple. The obvious limitation, I think, for a clinician is that you don't do hypnosis as entertainment, and you don't do it if you're not trained. It's same as anything else. You really want to seek appropriate training. Interestingly, training for hypnosis puts people often in a multidisciplinary kind of setting. Because if you go and get formal training in clinical hypnosis, you're probably going to be, as a social worker, you're going to be with other social workers, but you're also going to be with physicians, with dentists, with nurses and so on, because typically those trainings are multidisciplinary, which is actually a very, very interesting, in addition to getting the training, it's a very, very interesting setting in which to do some learning.
If somebody's listening to the podcast and they say, okay, this sounds like it would be really a useful skill for me to be able to have as an adjunct to what I normally do in my treatment, are there other references? Are there books? Are there authors? Are there specific places where people could go to get training that you could recommend or that you would say off the top of your head?
I think I would probably start with the American Society for Clinical Hypnosis, which has an excellent website, and I would also probably look at the Milton Erickson Foundation website. But the American Society for Clinical Hypnosis, which is fondly known as ASH, runs a number of trainings across the country. And these are very experiential trainings. To be an ASH-approved training, it has to not just have lecture content, but it has to have practical learning. So learning how to induce trance, being the recipient of that, and really is quite extensive training. There are many places that you can do an online or a weekend course, or and get I think you can even get a doctorate in hypnosis. That really is not the kind of training I would recommend, I have to say. I would say start with the American Society for Clinical Hypnosis. It is one of the very few national and long-standing professional organizations for therapeutic and clinical hypnosis.
Well, Dr. Winter, this has been fascinating for me. I hope for our listeners. Thank you so much for being here and talking with us today about clinical hypnosis.
It's my pleasure.
So, I'm Jonathan Singer. Thanks for being with me today for this episode of the Social Work Podcast. If you missed an episode, visit our website at socialworkpodcast.com. If you have suggestions for future podcasts, please email me at jonathan@socialworkpodcast.com. And to all the social workers out there, keep up the good work. We'll see you back here next time at the Social Work Podcast.